Please join with me in lighting the chalice. The words are in your order of service. We light this beacon of hope, sign of our quest for truth and meaning, in celebration of the life we share together.
While the flame is burning, may our hearts be still and quiet as we continue to look inside ourselves for a meaningful time together in community together. Thank you. Welcome to the Unitarian Universalist Congregation of the Low Country. Our privilege here is to be able to offer you this kind of time together, to be able to think introspectively, and to be able to look inside yourself as we hear from those individuals who give us a deeper insight into our world and to our own humanity. In a moment, I'll be welcoming Lynne Eickholt to our pulpit, but for now, let me take a moment to greet those of you who are guests and visitors today. If there's any first or second time visitors on my far right, if you would, yes, if you would, Jim. Introduce yourself to us. Sorry.
We were waving to each other. My name is Jim Pine, and been in Bluffton for about 10 years now. We live in Hanson Lake, and just came across your church. The pastor was nice enough to minister to my mother-in-law, who is in hospice care right now. And my daughter and daughter-in-law together up in New Jersey got their
You found one. Well done. In the middle section, any first or second time visitors willing to stand and give us your name and tell us a little bit about where you're from. And on my far left, your far right, anybody in that section new guest with us who would like to introduce themselves. So there's other announcements that need to be made. Linda, where are you? Yes, if you would, please.
Hi, I'm here for the cookbook committee. We are very busy putting together all the recipes for the cookbook. We still need more, and there's a beautiful box out. There is not a beautiful box.
It's coming.
There will be a beautiful box out in the vestibule. But if you have some recipes that you'd like to send along to us, please don't hesitate to email them to either Lynne, Nordberg, Marianne Sinelli, or myself, and we will make sure they get into the book. We're starting to go through collate and format and all those kinds of things. I don't want to promise. Should I promise it by a certain? No. Okay, we are hoping for a particularly good date for it to be out. But that's going to depend on whether or not you send the recipes. Okay, thank you very much. So please just send those recipes along.
And David, oh, yes, if you would, please.
The new president. Thank you, George. I just want to briefly recognize Clay and Wynette Barnard. Clay has just finished up 3 years as our president, and he and Wynette has been very engaged in our success over these past 3 years. Without Clay, you can't have Wynette. You can't have Wynette without Clay. They are. Yeah. You know their story. They led us out of COVID-19 years because you lived it, you were engaged in it, and you embraced it. I'm referring to the Barnards leading us, the whole congregation, through a process called design thinking, which resulted in the congregation, us, deciding on 3 prominent strategies for our near-term objectives. And they were spirituality and engagement, growth, and financial stability. Collectively, seeing this baseball season, I'm going to use a baseball term, the congregation hit it out of the park. I mean, it's just been spectacular. When we first started opening up the doors again, back when COVID was starting to wind down on a pandemic basis, we averaged about 45 people each Sunday for months and months. And then through the design thinking process, coming up with our strategic plan and executing it, we're now averaging close between 95 and 105 people each Sunday. So, well done. And frankly, I don't think we would have gotten here without the Barnards. They led the whole design thinking. Clay was our president and kept us on message through those 3 years to get us to where we are today. So congratulations to them. There are countless things that they have done for us, but I'm just going to list under each of the major categories just a couple brief items. But before I do that, Wynette, just for today, if you had to choose between green and yellow, which color would you choose? Green. Wynette gets green, Clay gets yellow. So under spirituality and engagement, we implemented monthly themes. And some of these things are going to, yeah, we used to do that. Well, that's the point. You know, when we got down to 45, we opened up the doors, people coming back in, we had to re-engage. We had to bring back the congregation that we walked away from, closed the doors on in 2020. But some of them are also new. implementing monthly themes, Charlie's weekly message via internet, growth in talkback attendance, solidifying our groups of ministers and improving our speaker program. Small group dinners, committee fairs, movie night, and continuing to build our beloved community. Under growth, approximately 25% growth in membership. Developed or improved the website on Facebook and Instagram, connecting with younger families. Get my fingers to work. RE program revitalized. I mean, we were down to nobody. And it's hard to grow a youthful organization when you start from scratch. When there are more kids around, kids like kids, and it's easier to build. So kudos to Ann to follow through on that and revitalize our children's program. Developing a youth group formed from UU 101, created and implemented Path to Belonging, which many of our new people have all gone through. The buddy system for new members and improving communication within the congregation. And finally, financial stability. Increased pledges during the stewardship drive, increased fundraising through Music on Melfres, legacy campaign, rummage sale, prioritizing building and ground projects, implemented cost of living increases for our staff, and energy efficient changes. All these and other accomplishments were made possible by having a focused path forward, design thinking in the strategic plan, and a congregation and committees who embraced the same. We couldn't have done it without the congregation. So congratulations to the Barnards.
A couple of things that were going through my mind, David, while you were reading Clay's accomplishments. One is Clay has every right to be absolutely exhausted at this particular point in time, and just jubilant that that he gets to become just another member, sort of. And the other thing too, David, is that as you were reading, I knew the bar was getting higher and higher for you. So just be aware of that, right? Thank you guys. It's been a joy to be with you. Clay and I would meet just about once a month, right before every board meeting, just to talk about things and how things are going on. David and I will start that. Clay will join us as I meet with him in the months ahead. So thank you guys for your leadership, for the skill that you took to get us through some of those hard times. Special gift here, special gift. Some dates that I want to draw to your attention, to save the date, or is that safe the date? I think we'll save the date. July 19th from 7 to 9 o'clock, membership committees organizing a bunko night. The information is there in front of you. Please, if you would, come and join us. The UUCF cookbook committee is now collecting. I know we spoke about that earlier. You'll see those who are going to be speaking at our congregation this coming Sunday. Rabbi Robert Haas, many of us know him and his delivery. He's someone that we all look forward to. Katie Sieber, who will be speaking to us as well, and then later on in July, some other guy delivering a message. So I do want to introduce to you now, if I can, Lynne Eickholt. Lynne is retired as the Chief Strategy Officer for Massachusetts General Birmingham, the largest health system in Massachusetts. Brigham.
Not Birmingham.
Oh, it's Fordham, thank you. In Brigham. The largest health system in Massachusetts after a long career in health and human services. She has degrees from Wake Forest, UNC Chapel Hill, and Harvard. Apparently she couldn't get into any good schools. Her first real job was in the South Carolina state government, which led to a love of the Low Country and retirement in the Charleston area. Since 2022, she's been an executive team of Cover SC, a 150 and more organization coalition advocating for South Carolina to expand Medicaid eligibility under the Affordable Care Act. I can assure you that these are daunting times for her as well as for us. So with that, I take great pleasure in welcoming to the pulpit for her opening words, Mrs. Linda Eickholt. If you would please, Lynn.
my opening statement. Thank you for having me here. And you may wonder, after last week, you may think, bad timing. I mean, there's just no way. The entire bill was an attack on Medicaid. Why are we going to talk about expanding it here in South Carolina in a very Republican state? And I'm going to tell you, it's gotten harder in some ways, but I'll talk about how aspects of the new bill are going to create a crisis in South Carolina, and that crisis may not be able to be solved without Medicaid expansion. And so it creates a new opportunity for us, and I'm going to explain it. And what I would say is my main teaser, there is absolutely nothing we could do in one singular way to improve South Carolina's health status. And you know, we're in the bottom 10 on most things in the country. Nothing that we could do that is better in one singular stroke than signing legislation that expands Medicaid. And I will explain why that's true. There's also nothing we could do in one singular stroke, not recruit any new businesses, Scout Motors, Boeing type businesses, other than passing Medicaid expansion. It would boost our economy more than any other thing that we could do. So I will explain why in my 15 minutes talk in a bit.
Thank you, Lynn. We're looking forward to hearing how we all get to figure out how to walk on water for the next several years. If you would, please take your hymnals in your hand. Turn with me, if you will, to hymn number 101, and maybe stand and sing together. If you're able and willing, abide with me.
This is the time where we share in our abundance, and I want to thank everybody that has brought donations of non-perishable items that we can share with the Sandalwood Food Pantry and Bluffton Self-Help. Please don't forget those on Sundays. I've seen something just very recently that's saying the food pantries are emptying out all over the country. So please do whatever you can to bring things on Sunday. And it's also the time where we share our abundance for the work that's done by this community within its walls and beyond. If you are one of our early visitors here, please let the basket pass because your presence is our gift today. you for your generosity.
And now we'll take this time to share with one another our joys and concerns. If you have a joy, please come forward, share with us your name and a brief statement or story of your joy and or concern. And in sharing our joys, we can celebrate with one another, and in sharing our concerns, hopefully we can help somehow relieve some of that burden from you. So please come forward if you have something to share.
Good morning, everyone. I'm Kathy Zeiser. They say when one door closes, another door opens. There have been a lot of joyful doors opening in my life over the last 2 months. I had a granddaughter graduate from the University of Pittsburgh with high honors. I also had a granddaughter that got married in March. And now I'm going to be a great-grandmother. Hello, everybody. I'm Kathleen Kelly. 2 weeks ago, Dave and I had the opportunity to attend the General Assembly of Unitarian Universalists from all around the country and from other countries. This was our first time attending the GA, and we have lots of thoughts to share with you. First of all, this is not included in the budget for UUCL. And so we paid for our admission, our ticket, and Barbara and Ed Popka generously gave us points so that that covered part of our hotel bill. So we want to thank Barbara and Ed. They're not here today, but that was very generous of them to step up and say, we could have the points. Now we were in Baltimore, downtown Baltimore, and the walk from the hotel to the convention was quite an eye-opening experience. Somebody told us we should watch The Wire if we wanted to understand it, because it was indeed the depth of the ghetto. And yet, the block right next door, we felt was a much safer environment. So we learned about that. We never got a number for how many people were attending. 1,000 is our guess. It was an unusual convention for us. We've been to lots of conventions as professional people, but this was different from anyone we've ever been to.
Where was it?
It was in Baltimore, in the convention center. Everybody wore masks. There weren't very many congregation gathering places. You went to a workshop, and then they didn't have coffee stations, there were no common meals. Part of it probably came from COVID, probably from cost saving. We never really understood. We heard excellent speakers. The workshops were a little unusual for us because we didn't know what was going on. We were newcomers, and workshops were offered by people who'd been working for years on different themes. So it's hard to jump in as a newcomer and learn a lot. So was it a great experience? We both think it was an unusual, uplifting. One thing we did notice, about 1/3 of the people attending were openly either gay or trans. And 1/3 of the people. That was a pretty predominant presence in the group. There was a worship service every day, and that was our favorite part. Imagine 500 people, Unitarians. They sang a lot louder than we do here, I'll tell you. There was highly energetic leadership. The best workshop I went to, and Dave went to it too, was about, what was it called? Radical welcoming. How we can welcome newcomers in more radical ways. So you watch out for that. We'll be seeing it. Now, I wanted to bring presents back, so we bought some books for Anne and left them on her desk. We have some books for Charlie from the speakers we heard, and a book for Ed and Barbara to say thank you. In summary, next year it's going to be all virtual. And so I would encourage you, we learned a lot about Unitarianism. Probably the best thing was just being able to talk to people in restaurants, because we took over the whole downtown, so you'd walk in and know somebody was at the meeting that we were at. Another observation was that there were banners, and we don't have a banner. So UU Beaufort, UU Savannah, they have banners. So one thing, if any of you are quilters, artists, it's a fabric banner that hangs vertically. Talk to us, because we'd love to commission a banner so that our name can be hanging up there with all the others. Thank you.
My name is Lynne, and I have a concern about our immigrant community and the kind of fear that these people are living in. And there are two opportunities this week to show our support for the immigrant community. You may, pardon me, you may be aware that Sheriff Tanner has filed an application so that he can be certified as an ICE agent. And that would not be a good thing for our immigrant community. The county council in Beaufort is having him, Sheriff Tanner, speak at 5 o'clock on Tuesday. And there will be a very brief time for public comments. So it's an opportunity to show up and show our support. There also will be a protest on Friday at 5 o'clock? Yeah, 5 o'clock, meet in Shelter Cove near Tio's, and then march up to Sheriff Tanner's office just to show our concern for the immigrants. Thank you.
I'd just like to ask everybody to keep in their hearts the families and victims of the floods in Texas, particularly the children. They went off to have a great time. Their parents sent them off to a great time. And this is what happened. So please keep them in your hearts.
Else has anything, I will place 2 stones in the cairn for the joys and concerns that remain unspoken. I will also place a stone for the children's lives and the families' lives that have been affected by gun violence. And now if you will join me in reading the affirmation in the back of your hymnal, it's number 562. Love cannot remain by itself. It has no meaning. Love has to be put into action, and that action is service. Whatever from we are, able or disabled, rich or poor, it is not how much we do, but how much love we put into doing. A lifelong sharing of love with others.
One of the things I wanted to do as we focus our hearts and our lives around the significance of what we'll be hearing this morning from Lynne, so I wanted to remind you that as we consider some of these medical issues that are before us, is that almost, if not all of them, reflect our values. To struggle to keep these kinds of programs in place is our struggle to recognize who we are. And just quickly, the values that we share here are our interdependence, our pluralism, our justice, our transformation, our generosity, and our equity. It is around these values that we weave our hearts, weave our spirits, and weave our mission. And so with that, I would invite Lynne to the pulpit now, if you would please, and give us a deeper vision of how we might move forward. Thank you, Lynne.
Please keep me on time. So wave a high sign if you think I'm going too long, and I'll bring it to a close. You have 3 things in your packet, and I'm going to use those to speak from as opposed to an overhead. One of them, which is why we need to close the healthcare gap, is the main document I will speak from. I've also provided some statistics on Beaufort County and how it would be impacted by Medicaid expansion and some of the healthcare problems. Beaufort County looks pretty good, actually, compared to a lot of South Carolina. If I were to bring Jasper, they wouldn't have looked quite as good. And I brought a document that says why the cost to the state of expanding Medicaid is not that great. It's like buying a car. The sticker price is never what you pay. The sticker price of Medicaid expansion is not the real cost, and that brief document explains why. And both of those, the Beaufort and the cost document, and anything else, I will be available for anyone who wants to discuss more after this, and I look forward to it. This service feels like home. My home church is congregational, circular congregational in Charleston. And actually, the Medicaid expansion effort started with me in the circular and a colleague in the Unitarian Church in Charleston. And the 2 of us got together, and I know why I was interested in Medicaid expansion given my background in healthcare, and Massachusetts was the prototype for the Affordable Care Act. So, and I lived through it at my healthcare system, and I thought it was the best thing that our healthcare system did was they were very central in lobbying for the prototype to the Affordable Care Act in Massachusetts. It was passed under Mitt Romney, a Republican. So, and I was very proud of my healthcare system for doing that. So I know why I worked on it. My colleague in the Unitarian Church was a lawyer at Bell's, retired lawyer at Bell South. And I said, why did you start researching this? And he said, I don't know. I guess I'm just a bleeding heart. So that's what he said. But the 2 of us, who knew very little, got together with the League of Women Voters. They knew how to put on Zoom forums. This was during COVID. And we did 2 Zoom forums on Medicaid expansion. It got the attention of the statewide league, and it got the attention of some colleagues in foundations. A foundation group started and looked at funding the effort to push Medicaid expansion. And then the people who really are advocates and know how to do this stuff said, it's time to go, let's go, and form a coalition. So I consider the Unitarian Church to be part of the spark that started this whole thing. So keep it up. So let me talk about why I'm here, despite last week and the legislation that passed. So if you understood the legislation to be an attack on Medicaid and Medicaid expansion particularly, you're right, it was. I mean, what this bill does is basically try to destroy the Affordable Care Act, Medicaid expansion, and the exchanges without repealing the bill. Somebody who is very smart and determined figured out about 25 ways that I could pick it apart and pretty much try to destroy it. And that's the bill that we have. And there is a second provision that is not, it's not in the bill, but it's going to happen, which is the Biden administration passed 2 laws actually, that enhanced the premium subsidies on the exchange. And you may not know it, but South Carolina was one of the main beneficiaries. Non-expansion states are the main beneficiaries of that Biden law. And South Carolina's membership on the exchange grew from 200,000 in 2021 to 600,000 today. And that's why we have a lot more people insured. If you are less than 150% of poverty, your premium is 0 on the exchange. It's gonna go up astronomically in November because the Congress is letting that provision expire. It expired in 2025, they are not renewing it, it's gone. So the estimates are that South Carolina is going to see, with some impacts on Medicaid, but because we haven't expanded, it's sort of modest impacts on our baseline Medicaid program. In states that have expanded, it's huge impacts on their program. But here, the Medicaid is small, but we expect 230,000 more people to be uninsured in this state starting in November for the new fiscal year. So it certainly, the Republican administration of this state is not going to be eager, given the national push, to secretly, if you will, not so secretly, but in 25 cuts, small little cuts, to undo Medicaid expansion and the Affordable Care Act. So it's clear it's going to be a harder climb for us. However, when you have 230,000 more people who are uninsured, one, and two, another provision, and this gets really tacky, but most states pass or use as a match for Medicaid taxes on providers, mostly hospitals. They tax the hospitals, they use it as the state match, and they get, in this state, 70% of the cost of Medicaid is covered by the federal government. And so what they're doing, though, is through various provisions of the bill, they are going to chip away at the ability of this state to use the taxes to keep our hospitals afloat while they are caring for so many people who are uninsured. And the head of the Hospital Association was quoted today in the Charleston City newspaper and in the State House Reporter, and the editor of both is the same person, but the head of the Hospital Association said we're looking at a $2.4 billion cut for hospitals, and we can't survive that in this state and continue to keep our small rural hospitals open, and a lot of hospitals will not be viable. And so the combination of the increase in uninsured and the hit to the hospitals by an arcane change in the way that you are allowed to fund Medicaid together, that's going to hit the hospitals, are going to create a crisis here in South Carolina. And I think there is an opportunity to push even harder to expand Medicaid. It'll be harder to do, but the crisis will make it more imperative to do it. So we're going to keep going, and it may take a few more years, but we're certainly going to keep going, and there's good reason to do that. So I told you that there's nothing we can do to improve the healthcare or to expand our economy more than expand Medicaid. So why haven't we done it? And there is, I think, one main reason. People will tell you lots of different things, but one main reason, which is there is a belief that people need to be responsible for themselves. And if they would just go to work and work enough, they're going to be eligible for employer insurance, and the private market will solve the problem. And that's why you see a big part of the new bill is all about work requirements for the expansion population, because the belief is folks just don't work at all, or they don't work enough. And so they've got to, we set a minimum, and if they want to get government benefits, they need to show that they work. And that is a strong belief among conservatives, among Republicans. And if I leave you with one thing today, this is it. And it is actually in the page on why we need to close the healthcare coverage gap. If you pull it out and you look in the bottom, I'm jumping around here, I'm not going to go in order, but at the bottom of one side of why we need to close the healthcare coverage gap, it has the statistics, and it's from the annual census that is done, called the American Community Survey by the Census Bureau. People on Medicaid, the majority work, are in school, period. That's the reality, that's the truth. And most of the rest that don't work have two reasons. They're either at home taking care of a dependent, they can't afford childcare, or they are too ill or disabled to work. And that leaves a single-digit number, 8 to 9%, who don't work for other reasons. I am okay as a very progressive person. I'd be okay with a work program that is targeted at people that are not working at all and don't have a reason to not be working. My program would not be punitive, like work or else. It would be supportive. Why aren't you working? There's got to be reasons, right? For most people, there's reasons that they're not working. But I would be okay for a work program targeted there. But a work program for people that already work, and you may say, well, what's the problem? I mean, they already work, so they'll document. Twice a year they have to document if they work. We've experimented with this in 2 states, Arkansas and most recently Georgia. It's a disaster, an absolute disaster. It is not easy to verify that people work 80 hours a week. And the folks that we're talking about, this is another very important point to understand. Most people work, but the jobs they work, and they're listed here: construction, food service, janitorial, child care, personal care aides. These are the jobs. Most of them are hourly. Many of them have schedules that are set by their employers, and they will tell you, this week you're going to work 20 hours and you're going to work this shift. And that's typical for people at this low end of the wage scale. And so showing that you've worked 80 hours for the last month or last 3 months, which is required by the bill, is tough to do because they're not in control of their hours. A lot of workers are seasonal. So the red tape and the difficulty of documenting, have you worked the required number of hours, is huge. And in both cases, Arkansas and Georgia, in Arkansas, people were disenrolled. 18,000 people were disenrolled. A study done by the Harvard Public Health School found that 95% were actually eligible and met the requirements, but it was the administrative paperwork gummed up, they were disenrolled. In Georgia, they projected they would have 100,000 people that could benefit from their expansion of eligibility under Medicaid. 6,000 people have been able to sign up. They have a work requirement. If you read anything about it, just Google Georgia Medicaid expansion, Medicaid, and you'll find quotes from people who work hard, but they couldn't get through the system. So it hasn't worked, and the states have 1 year to get ready to implement work requirements, and it's a massive, costly thing to verify. And so in the 2 samples we have, it hasn't worked, and there's no reason to believe that it will work. So let me talk about the one other thing you need to take away besides people work who are on Medicaid already or are in school, the majority, is that the private insurance system in this country is not working for those folks. Why? And on the top of the page, why we need to close the healthcare coverage gap, 79% of small businesses in South Carolina, we are one of the worst states in the country for small business healthcare coverage. 79% of the businesses, small businesses under 50 employees, they don't offer health insurance, period. So half of all Medicaid recipients work for small businesses. So you don't have an offer of health insurance, no matter how hard you work. This next number blew my mind. I wasn't surprised with small businesses. But looking nationwide, and I got this from the Bureau of Labor Statistics data, nationwide, people in the bottom quartile of wages, a little more than a third, even have an offer of health insurance from their employer. This is all employers, all employees nationwide. In the bottom quartile of wages, only a third have an offer of health insurance. Why? Because many of them are contract, gig, part-time, and not eligible for the health care coverage. What businesses are doing today to manage ebbs and flows of demand for their services or unexpected events or challenges financially is they are making more people part-time so they don't have to offer benefits. And this is true at Starbucks and Target and Amazon, and many businesses are choosing to have 60 people part-time rather than 30 people full. I don't have to pay benefits. I can tell them what schedule I want. I can schedule according to the demand. It's a way businesses are managing today. And what I learned by reading about sort of employment today is our notion and conservatives' notion and our notion of the job market is based in the 60s and 70s and 80s, not in the economy we have today. 40% of people in this country work in service industries at entry-level, low wages. That's the truth. That's our economy today. And if you Google United Way, you will see they have a national program that is focused on asset-limited, income-constrained, employed people. It's kind of tech thing. It's called ALICE. But if you look at information on the United Way website, they say the same thing. 40% of people in this country are scraping to get by. They can't afford housing, they can't afford their health care, and they are scraping to get by. It explains the anger that led to this election, but we have to stop thinking about people just need to work. If they work hard, they'll get a good job and they can afford all of this. No, not true. So when we talk about, as folks who care about social justice, because we're Christian, that we need to help the poor and vulnerable, a lot of people were talking about, yeah, they're low income, but they work really hard. And we need to start saying that constantly. The private market is not working for them, which is why a combination of Medicaid at the low end and the exchange with subsidies, scaled subsidies, are critical in order to give people health insurance in this country. So let me give some of the numbers. South Carolina had in 2022, which is where the data is from in this document, had 400,000 uninsured people. It's less now. I just told you, come November, a lot of people are going to lose health insurance. It's going to go back to 400,000 or more where it was in 2022 because of the expiration of exchange subsidies for people at the low income. Our estimate, and we had an economist at George Washington do analysis for us, is that 340,000 people could be covered under Medicaid expansion in South Carolina. It would cost us 10% for expansion. The match is 90%. Our regular match is 70%, but it's 90% for the expansion population. Our 10% is $356 million in the third year after it ramps up. That's 2 to 3% of the state budget, and we'll afterwards, for those of you that like to talk about it, that cost is almost paid for by the new tax revenue and by savings in state programs, almost all of it. That's the real cost. This is the sticker price, not the real cost. The investment is $7.2 billion in the first 3 years. That 90% match is $2-point-something billion every single year. So when you think about That investment, and if you flip this over, the economist at George Washington, closing the gap leads to a stronger economy, and I said there's nothing we could do that would be a bigger boost for our economy. The estimate, and we're using the same kind of multiplier analysis the state does when they talk about what Scout Motors will do by bringing Scout here. 29,000 new jobs, 2/3 in healthcare, 1/3 beyond healthcare. 345 million, and this is over 3 years, in new tax revenue and 12 billion in new economic output. In your Beaufort County page, we've broken that down for Beaufort County. So it's a huge economic investment. We've already paid for it, right? The Affordable Care Act was funded by a number of things, one of which was a cut in the inflation for providers under Medicare. And so we have already paid for it in this country and in this state, and we're letting the money go to 40 other states. So let me close with talking about the healthcare benefit. I mean, we lead with the economic benefit for our audience, but for this audience, I mean, the healthcare benefit is phenomenal. I mean, my job was research and analysis, and in my profession, and there's over 600 studies done of Medicaid expansion, states that have expanded compared to those that have not. And it's overwhelming. It is overwhelming. Mortality. Mortality drops 12% in the first 4 years in states that have expanded amongst the 55 to 64. Thankfully, people younger than that don't die often. Even if they're sick, they don't die. And 20% of people we're talking about are 55 to 64. You know, you would, if you listen to Speaker Johnson, he talks about the 29-year-old bros who are sitting at home video gaming and we don't want to give them health care benefits. That's not who we're talking about here, covering. So 12% decrease in mortality. And you'll see, again, on the page about Beaufort, if you flip it, you see some statistics about South Carolina and our health status as a whole. We are 10th worst in premature deaths. That's deaths under 75 that are due to chronic conditions that are treatable and avoidable. So a 12% decrease in mortality. This one blew me away too, 47% decrease in medical debt. Medical debt is the worst problem in financial stability that the families in that 40% have. Medical debt causes, you know this, more bankruptcies than any other kind of debt. And Medicaid expansion states have a 47% decrease in medical debt. And South Carolina is once again amongst the top handful of states in the level of medical debt in South Carolina. 18% increase in access to diabetes care. Study done by the Cardiology Professional Association found in Medicaid expansion states there were 31% more hypertensive drugs prescribed. That makes sense. People are actually taking care of hypertension, and this one is critical. We are, I believe it's the 8th. It's on the back of the Beaufort County page. We are the 8th worst in maternal mortality, and this 8th worst in a country that has 3 times the maternal mortality of any other developed country, anywhere. So we start out as the United States, horrible, and we're the 8th worst in the United States in maternal mortality. Medicaid expansion is shown to decrease maternal mortality 20%. Why? Somebody's going to tell you, we already cover pregnant women, and we now cover them postpartum for 12 months, which is good. That is good. We opted to do that. However, if you go into pregnancy sick, if you go in with hypertension or high cholesterol, your odds of a good outcome go down dramatically. And so you don't just cover somebody when they get pregnant, they need to be healthy before they get pregnant. And that's why there's a 20% decrease in maternal mortality in states that have expanded versus those that have not. So these are some of the statistics. There are many more, but these are, the references are there, they're documented, it's good studies. So that's why I say there's nothing we could do to improve our economy. It's a good one already, but to further improve it, and nothing we could do in one fell swoop that would do more to improve our health status in this state than expand Medicaid. We're gonna have some crises in hospital funding because of the arcane thing I talked about in the bill, and because so many people will not be able to afford insurance on the exchange and will be uninsured. Those crises give us an opportunity to push this issue. And I hope we have a little QR code. We want lots of individuals to sign up. When you have a chance, please use your phone, and this will take you right to our website, and you can just sign up in 2 minutes as an individual. We're funded well by foundations. We're not going to ask you for money. We're not going to pepper you with materials. You would get a notice when it's time to really take action and press legislators and ask for your help. But just having a big list of people, individuals, as well as the 150 organizations that have signed on are great. So I encourage you to do that. And I really would be delighted to talk to you more, answer your questions, talk more about Beaufort, about the cost issue. So I hope some of you will stay. Thank you.
If you would please turn in your hymnals to hymn number 318. And maybe stand together and sing We Would Be One. seated. I'm going to ask that the words that we just sang be the final remarks from Lynne today, that we might be able to see the value and see the direction that we need to be going in our own hearts and in our own lives. I do want to thank Jim Pine for being here today. Thank you for coming. We look forward to seeing you back. We're open most Sundays about the same time. Look forward to seeing you. Also to remind you that we will be gathering back here about 11:15, maybe 20 after 11 for our talk back, and looking forward to being able to ask Lynne more questions and get more depth from understanding. So with that, I'm going to ask that we extinguish our
Final words.
No,
She has spoken. That's what I meant by the words of the hymn, to be the final remarks. So we'll continue with that, if you would, please.
We're calling audibles now. If you would stand and join me in extinguishing the chalice. Again, the words are in your order of service. When we extinguish this flame, we still carry in our hearts the light of truth, the warmth of community, the fire of commitment, until we are together again.
Great.